So how do polynucleotides compare with under eye fillers? Polynucleotides are gels that we can inject, but they are made up of chains of nucleic acids, the bases of our DNA. So when they're injected, and they can be injected in anywhere on the face, the body, the neck, the hair, the eyebrow, they can help to stimulate collagen and elastin production, potentially improve hydration in the skin. There's also some talk that they may reduce hyperpigmentation and that they may also have anti-inflammatory properties, which could be helpful for people who suffer with, for example, rosacea. When we have polynucleotide treatments, we do a series of sessions, and it could be anywhere between 2 and 4 sessions, spaced 2 or 3 weeks apart. And that helps us to get this regenerative effect because the product itself is only in the injected area for maybe 2 weeks or so. After that, it's gone, and we're relying on this repeated stimulation of those fibroblast cells in order to see the tangible results. These small chains of nucleic acids, as I said, are stimulatory to the body and to the skin. The stimulation can lead to the formation of new collagen and new elastin, so they can be good choices for people who have skin crepiness, some mild laxity of the skin, and whose skin lacks radiance. And they're quite different from other injectables because when we're talking about everything except muscle relaxants anyway, most injectables that we use are made of hyaluronic acid, and polynucleotides are different from those. Some hyaluronic acid injectables are also regenerative in nature, but the polynucleotides we do class as a regenerative injectable. Hyaluronic acid fillers and skin boosters can make people a bit more prone to water retention, even if it's just in the short term, because as we've talked about so much before, hyaluronic acid is the skin's natural sponge. Polynucleotides in principle may help those who are prone to a little bit more water retention by reducing that. Further, one thing that I really like about polynucleotides is that I can use them around the eye. I have other great skin boosters in my portfolio which I'm comfortable give me great results in the majority of people on the face and the neck, for example. But when it comes to the area around the eyes, we don't really have other options. This partly stems back to what we were talking about with hyaluronic acid and the retention of water, because retention of water around the eyes can be more problematic than in other areas and definitely more visible. We can use hyaluronic acid around the eye in the form of mesotherapy, but this is a little bit different than when we're talking about regenerative aesthetics. So with the polynucleotides, we can inject the gel using either a cannula or a needle into this periorbital area, and that can lead to improvements in the skin thickness around the eyes, better hydration, so therefore less crepey skin, hopefully reductions in fine lines and wrinkles, and to improve any dark circles that people might have. They can be injected depending on what we want to achieve with either a cannula or needles, or a combination of the two. Tear trough fillers, on the other hand, involve the injection of a cross-linked hyaluronic acid product, and cross-linked means it's been stabilized in a laboratory, so it will stay in the skin for months to even potentially a few years. That can be really great when we want to correct volume, because the product will stay there so we can get some tissue lift. That tissue lift lasts by virtue of the fact the product is still there, which is quite different to how polynucleotides give their results. Under eye fillers can be great for very many people, although I do unfortunately hear a lot of stories about people just having their tear trough injected without an assessment of the cheek area or the surrounding temple areas, which are very important to how the under eye area looks. And when people have the tear trough injected inappropriately, that's when we can run into trouble, be it puffiness, water retention, malar edema, or festoons. That puffiness around the eye can be quite challenging over time, and many people even feel like they can see a pocket of filler. When we compare that with fillers, it's often a single treatment session, and with polynucleotides, it's multiple treatment sessions, you can understand that the process differs. And with fillers, people often see their results straight away, whereas with polynucleotides, it's delayed. They also differ by virtue of what their key ingredient is, hyaluronic acid versus polynucleotides, and they differ by the result they achieve as well. So So with fillers, we're largely targeting volume, whereas with polynucleotides, we're largely targeting skin quality. So herein lies the key, picking the right person for each treatment. With fillers, it's people who have lost volume, but the important thing is to remember, assess the cheeks first, assess the temples first. Aim to improve the tear trough indirectly as much as we possibly can before going in there for direct injections. Polynucleotides are great for people with a little bit of laxity or crepiness around the under eyes, and maybe the very mildest hollow could be improved by polynucleotide treatment, but you're certainly not going to get the volumization you do from filler. Therefore, for people who are very hollow under the eyes, it may be underwhelming. To reiterate, two great products that I use really regularly in my clinic. Myself and my team, we love both fillers and polynucleotides, but it's important to remember that one isn't an alternative to the other. They're different treatments that do different things, and some people even benefit from having both. You can have polynucleotides to improve the skin envelope around the eye area, and you can have fillers to restore that deeper lost volume around the eye. Polynucleotides, because the product is disappearing within a couple of weeks, are associated with a much lower risk. Fillers in good hands also have a low risk, but unfortunately I think we see far too many people injecting fillers, and especially some of these more complex areas nowadays. And so for me, tear trough filler really should only be a specialist procedure that's performed after indirect correction has achieved the best result we can possibly get.
If this content has been useful for you, please give it a thumbs up or send me a little message below, and please do subscribe if you'd like to see more content like this.